I'm going to tell you something about teeth in a day that nobody in a typical consultation will admit. Because if you understand what I'm about to show you, it changes everything. I've done this procedure on over 2,000 patients. I did it on my own grandfather at 94 years old. I did it on my mother in law. I know exactly when it works and exactly why. We're going to walk through what actually happens on surgery day, why the old timeline exists, and what creates it, how the manufacturing process works when it's built in house, what your healing looks like, and why it moves faster this way, and what to ask before your next appointment so you walk in prepared. The story most patients hear sounds like this: full mouth reconstruction takes 1 to 2 years because that's how long your body needs. You hear about healing periods, waiting for bone integration, stage procedures. And because it sounds medical, it sounds set in stone. That framing isn't entirely wrong in the traditional model. In that model, the surgeon who places your implants is at one office. The lab that makes your teeth is somewhere else entirely. The restorative dentist who handles the final fit is a third person. When something doesn't fit right, the case ships back to the lab. The lab takes weeks to fix. When then it ships back. Then you wait for another appointment. The 2 year number is real in that system, but the system is the problem, not your biology. The flaw is that patients assume the timeline reflects what the body requires, when it actually reflects what the process requires. Those are completely different things. Your bone isn't asking you to wait 2 years. The coordination gap between disconnected offices is asking you to wait 2 years. The 2 years isn't healing time, it's scheduling time. So, what happens when you remove the coordination gap? When the surgeon placing the implants, the technology making the teeth, and the delivery of those teeth all happen in the same place, run by the same team on the same day. The timeline collapses, not because corners are being cut, but because the delays never had to exist. When everything's in house, there's no lab to ship to, no third office to coordinate with, no weeks waiting for a remake. The process runs parallel, not in sequence. That's exactly how this works here. Surgery, digital manufacturing, and delivery happen the same day. 3 visits, start to finish. The 2 year process becomes a matter of hours because the bottleneck was never your body. What changes for you is the mental model. Stop measuring this against the timeline you were originally quoted. That timeline belonged to a different process. What happens between when the implants go in and when you wake up with teeth? Most people assume that making a full set of permanent teeth is a slow, manual process that takes weeks in a dental lab. And in a lot of cases, that assumption's accurate. Traditional cases do get sent to outside labs. The craftsmen are skilled. The work takes time. And if there's a problem, a misfit, a shade that's off, a bite that needs adjusting, the whole case goes back and you wait again. That's the standard model. It works. It's produced good results for decades. The reason most practices still use it isn't because it's optimal. It's because building the entire in house capacity to do it differently requires serious investment in technology, training, and infrastructure that most offices don't have. The flaw is that it puts your timeline and outcome in the hands of a chain of people and facilities who've never met you and have no stake in the result beyond finishing their portion of the job. A case number shows up at an outside lab, it gets worked on, it ships back. Nobody in that chain was there for your consultation. Nobody saw your face. Nobody knows what matters to you. When your teeth are made by someone who's never seen you, your outcome depends on information surviving a handoff. It usually does, but when it doesn't, you're the one who waits. The in house digital workflow changes every one of those variables. Here, the design process uses AI-assisted CAD technology, computer aided design, to build a digital model of your new teeth before a single piece is made. That design is then hand finished and manufactured on site. The people building your teeth are in the same building as a person placing your implants. If something needs adjusting, it gets adjusted the same day. No shipping, no lab queue, no waiting. The savings that come from not outsourcing lab work gets passed to you. The quality isn't lower, it's more consistent. because the team controlling it is the same team that did your surgery and knows exactly what your mouth looked like before and after. What changes for you is that you're not a case number moving between strangers. You're a patient whose result is being managed by one team, start to finish, in one place. Now, let me walk you through what you exactly experience on the day itself, what surgery day looks like from the moment you walk in. If this is the kind of information you wish someone had given you before your first consultation, subscribe. Every video in this channel covers something the standard appointment doesn't. One of the most common things I hear from patients before their procedure is that they don't know what to expect on the day. They've been given a general overview, they know it involves sedation, but the specifics are fuzzy, and the unknown is often scarier than the procedure itself. So let me walk you through exactly what happens when you come in. You're sedated, you're completely comfortable. Any remaining teeth that need to come out are extracted. The implants are placed. While you're still sedated, the digital teeth that have already been prepared based on your treatment plan are delivered. When you wake up, you have teeth, functional teeth, teeth you can see when you look in a mirror. The surgery day usually runs several hours. Post op discomfort is mild to moderate for 3 to 7 days and gets managed with medication. You'll be on a liquid and soft foods diet for about 8 to 12 days while the integration process happens beneath the surface with a gradual introduction of the foods you love cut up with a fork and knife. The question I get most often is, will those day one teeth look right? And the answer is yes, by design. The temporary set you get on surgery day isn't some placeholder that looks nothing like you'll end up with. It's a digital prototype that reflects the smile design you approved before the procedure even started. You don't guess at what your result will look like. You'll see it before it's made permanent. That matters more than most patients realize going in. The time between surgery day and your final set arriving, 3 to 4 months, isn't time you spend looking like something went wrong. It's time you spend testing your smile, getting used to it, and confirming that it's exactly what you wanted. That brings me to the healing process itself and why the timeline from surgery to final permanent teeth is faster when everything's built in house. Here's something that almost never gets explained clearly. The biologic healing process has its own timeline. Bone integrates with titanium implants over 3 to 4 months. That can't be compressed. That's real biology. But in the traditional model, the manufacturing process adds its own delay on top of the biological one. Cases go to outside labs, adjustments go back. Patients wait for their final set not because healing is incomplete, but because the fabrication isn't done yet. When manufacturing is in house, those two timelines stop compounding each other. The healing process does what it does, the manufacturing process keeps pace. At 3 to 4 months, when integration is complete, the final permanent set is ready because there was no lab queue to navigate. The wait is exactly as long as biology requires, nothing longer. Stop assuming that every day you wait before your final teeth is about healing. In a lot of cases, those extra weeks were about logistics. Start asking specifically whether the office makes teeth in house or sends work to an outside lab. That single answer tells you more about your expected timeline than almost anything else you can ask. Now, I want to close with the most practical part of this conversation: what to actually do before your next appointment to make sure you're asking the right questions and getting accurate information. Most patients walk into consultations without a way to evaluate what they're being told. That's not their fault. It's a gap in what the system offers them. The question I'm about to give you aren't trick questions or adversarial ones. They're clarifying questions. They help you understand the process you're actually being offered, not just the general category it falls into. Think of it the way you think about any skilled work. If you needed something custom built, you'd ask whether the person quoting you is the one who does the work or whether they'll coordinate with someone else. You'd want to know how long the process takes and what causes it to go longer. You're not being difficult, you're being informed. The patients who walk out of consultations with clarity are the ones who ask specific questions. The ones who stay confused are the ones who accepted general answers to specific concerns. Your results and your experience on surgery day are all shaped by decisions being made in that office. You have every right to understand those decisions before you agree to them. Step one: Write down whether you've received a 3D cone beam CT scan. If your current evaluation was based on standard x rays only, your candidacy assessment is incomplete. Ask specifically whether CBCT imaging was part of your evaluation. Step 2. Ask your provider whether fabrication is done in house or sent to an outside lab. Then ask specifically what happens to your timeline if a remake is required. That answer tells you whether the 2-year window is baked into the process or whether it can be shortened. Step 3. Ask whether you'll be without teeth at any point during the process. If the answer is yes, for any period longer than the hours of your surgery day, ask why. A properly structured same day protocol doesn't leave patients without functional teeth at any stage. Step 4. Ask how many full arch cases the provider has personally completed from start to finish, meaning implant placement through final delivery. The answer should be in the hundreds. If it's not, ask who handles the restorative portion and how that coordination works. Step 5. Ask whether you get to approve a digital smile design before your final teeth are made. If there's no design approval step, ask what the process is for requesting changes after delivery. That question alone reveals how much control you have over your own result. Same day teeth isn't a marketing promise. It's the outcome of a specific process that requires all the pieces to be in one place. When surgery, manufacturing, and delivery are coordinated by one team in one location on one day, the 2-year timeline doesn't apply. The biology still takes the time it takes. Everything else doesn't have to. If you want to understand more about how the evaluation process itself works and why so many patients get told they're not candidates when the real issue is something else entirely, the last video covers that directly. It's linked right here.